Taoiseach, far too many children in our society, in Ireland, for far too many of them, our country has become an unresponsive, hard and cruel place to live in. And I would argue that there is a fundamental lack of political prioritisation of the needs of children. Too many children in Ireland are homeless. Too many children are living in poverty. Too many children have to wait far too long for hospital appointments, be they outpatient or inpatient treatment. Access to mental health services for children and young people is shocking and unacceptable. Access to speech and language therapy, physiotherapy, occupational therapy and many other therapies are equally unacceptable. It's appalling the lack of access to such therapies at a time when they are critical in terms of the development of any child. For some children with special needs, access to special schools and school placements can be a very challenging journey, with very little advocacy for the child within the special education sector. The parents have to do all of the heavy lifting and beg for school placements, many of them suboptimal in terms of the needs of the child. We know that there are over 3,000 children homeless, living in emergency accommodation, but there are thousands more living with their grandparents, uncles, aunts and siblings of their parents. The stress, which we've all come to see every week in our clinics, is very distressing indeed to witness and very difficult on the families concerned. Mental health services, a lot of rhetoric, but they're clearly suboptimal. 6,000 children waiting for a primary care psychology appointment at the end of January 2018. Over 2,500 children, 1,600 of those, by the way, waiting over a year. 2,500 children and young people waiting for an appointment with child and adolescent mental health services. 350 waiting more than 12 months. And I can go on, Taoiseach. 15,000 children waiting more than a year for outpatient appointments. Close to 9,000 children waiting over 18 months for outpatient appointments in March 2018. You had pledged as Minister of Health that would be ended by the end of 2015. That hasn't happened. It's gone up tenfold since. And the questions I have to put to you, Taoiseach, fundamentally is this. Why are services for children across the board in so many areas so difficult to access and waiting times so long in so many areas? Is the government not ashamed of the very poor political prioritisation given to children's needs in our society?
Thank you, Deputy.
And can the Taoiseach explain the absence of such political prioritisation?
Taoiseach, please.
All of the key areas that I outlined in my opening question to you. And the fundamental point I would make to you is that children in need, children who are homeless, children who require special interventions, particularly children with special needs, they are not getting them and they are waiting far too long, be it any of the therapies you want to mention. You talk about waiting times. Since you were Minister for Health and since you gave a pledge that no one would be waiting longer than 18 months by the end of 2015, that waiting list has gone up 10 times since then. All of your own targets in the areas of mental health, therapeutic intervention, childhood assessment under the Disability Act have all become worse and worse as the months go on. Over 4,000 children waiting for an assessment. Early intervention is the key to a child fulfilling his or her potential. And by any yardstick and by any metric, the government is failing dramatically in relation to those targets.
Time is up.
And you can ask Bernardos, who know a thing or two about the needs of children, and they have stated this. They've called it the forgotten scandal in our society. So I really would appreciate, Taoiseach, if you could address more meaningfully the questions around mental health access for children, around special needs access for children, and so on like that, which are quite shocking indeed.